My name is Dory Madry. We live in Bella Vista, Arkansas, and my daughter is McKenzie Madry. She's 16, and we also have a son named Logan. McKenzie is the sweetest girl. What I love most about McKenzie is that she's a loyal friend to her friends, previously when she was in sports, to all of her teammates. She seems to always have that go-to personality, and then she's just super awesome all the way around. McKenzie had a bump on her leg, and her leg was starting to hurt back in October of 2020. It took us a few visits and a biopsy before we were sent to Arkansas Children's in December of 2020. We learned that she had osteosarcoma cancer, which is bone cancer.
So McKenzie presented like a lot of our teenagers who come in with various bone cancers. She was an active young lady, played lots of soccer, and started having some knee, leg pain, and eventually got to the point that it was bothering her enough that she sought out medical care. So we did x-rays and then MRI and saw that there was a tumor there of concern, and Dr. Montgomery ultimately biopsied it, and it was found to be osteosarcoma, which is one of the most common of the two bone tumors that we typically see in pediatrics.
Through her chemo treatments, the cancer drugs that they give to the patients, they watch for making sure that they don't damage any other organs like kidneys and heart. And so she would get echoes before every cycle of a chemo that had doxorubicin on it. And at her last round, before she was going in, and they had an echo, and they determined that her heart functions had severely diminished. And so we made the decision with the doctors that she wouldn't take that last round of chemo, and that we would monitor her heart conditions going forward. So they diagnosed her with cardiomyopathy in May of 2021.
I became formally involved in McKenzie's care last summer when she was transferred down here emergently due to decompensated heart failure. She has a dilated cardiomyopathy due to the chemotherapy she got to treat her cancer. So what that means is her heart is incapable of producing enough blood flow on its own. At base, your heart's job is to push blood around your body to get oxygen to your various organs, and because her heart muscle was so weakened due to her chemotherapy, it's unable to do that now. Her LVAD was put in September of last year, done by our two surgeons, Dr. Reamston and Dr. Greiton. A VAD, or VAD, stands for ventricular assist device. And so for patients such as McKenzie, whose ventricles are incapable of producing enough force to push blood forward, this device takes over and does that for them. This particular device is the most common one used, realizing that they're used much more commonly in adult populations than pediatric populations.
So McKenzie is the first pediatric patient to go home with the LVAD device in the state in which we are so thankful for, because we get to be at home and do different things. Before learning about McKenzie's heart failure, we didn't know about this device or how it could help. And I'm really proud of the team for really fighting and advocating for her to be able to go home and live a normal life.
So there's several things that go into her being able to go home, as well as why it was good for her to go home. She went home because with the device, she was able to get enough cardiac output or blood flow to allow her to get up and move around. It also helps her because she has extensive healing to do from her multiple leg surgeries, and the device allows that to go better because it supplies more oxygen to that side as well as the rest of her body. And it also lets her do some rehabilitation, that she's not limited by her weak heart as she learns to bear weight and walk and do the other things that she needs.
It's amazing that McKenzie's paving the way of, future kids, because every kid deserves to have a life at home outside of the hospital. As great as a hospital is, it's nothing like home. We are so thankful that we were allowed to do this, and whatever we can do to pave the future forward for other pediatric patients, we'll be there.
Being the first pediatric person with adult VAD in Arkansas is pretty amazing. At first, we didn't know if we were going to be able to leave the hospital or Little Rock in general, but we were able to train people where I'm from in Bella Vista so that I could go home. And it means a lot to me because I get to spend time with my families, and I won't be missing out on those family traditions anymore because I'm in the hospital. I would just like to say thank you to all the nurses and doctors and people in between that have been there to help me through this journey. They've really helped me out a lot.